Meniscal tears are a very common kind of injuries which are associated with knee ligament injuries. This is the normal meniscus. This is a model showing normal menisci. These two are the normal menisci inside the knee joint, which are actually the shock absorbing cushions. Very, very important structures. These structures, when are injured and are torn, must be repaired in order to save this meniscus, to save the joint, in order to preserve the natural joint in the body. So if you can see here, this meniscus can be divided as posterior horn, anterior horn, and the body. So the part between these two lines is generally the body, and the part between these two lines is the posterior horn, and this is the anterior horn. Injury of this posterior horn is the most common kind of meniscal tears, and the next meniscal tears which are common are the body tears. Anterior horn tears are quite uncommon. So this posterior horn tears, when are torn, must be handled with meniscal repair technique. So now when we are operating, important vessels, that is the blood vessels and the neurological structures, the nerves, which are very, very important for the knee joint, are just behind these posterior horn of the menisci. So when we are repairing this menisci, the posterior horn of the meniscus, we should keep in mind that we should not injure the nerves and the blood vessels just behind the meniscus. So all inside meniscal repair is a very commonly used kind of meniscal repair technique, particularly for the posterior horns, because all inside meniscal technique is a very safe technique which when used can be used to repair the posterior horn of the meniscus without damaging the nerves and the blood vessels, which are important structures in the knee joint. So Osteocare has got a user friendly all inside meniscal device which is called the OsteoStitch. So this device is absolutely designed for the comfort of the surgeon. So here we can see this is the actual needle through which the implants are generally deployed. This needle is a 17 gauge needle which is quite thin, which cause less damage to the meniscus when pierced. So this has got a 12-degree angulation which is very, very useful when we negotiate through the posterior part of the knee joint, pierce the meniscus. And here the handle, this is the handle which is used to increase or decrease the depth of the penetration. We want the needle to pierce more depth, we increase it. When it is less, we reduce it, because this length is actually measured using a measuring probe before piercing the meniscus, and then it is adjusted accordingly. Usually we put it to 16 mm to 20 mm of length. If you can see these two handles, these are actually designed for the comfort of the surgeon while using. So we can just hold it very comfortably in your 3 fingers in your hand and just use it to the penetration. Sometimes when we use it in difficult to negotiate areas, we might be holding it in this way. So when we use in this manner, the deploying handle, the implant deploying button is here, and when we hold it in this manner, the implant deploying button can be used here. Now I will be demonstrating how to use this OsteoStitch device in order to repair the posterior horn of the meniscus tear. This is how we handle OsteoStitch. We generally introduce it through the portal. So now we will demonstrate how to use this OsteoStitch device. Firstly, we introduce the sleeve, the introduction sleeve, which is a metal sleeve introduced through the portal, which can be used to reduce the meniscus tear. When the meniscus tear is here, so we can reduce the meniscus tear using this sleeve, and also this sleeve can be used as a guide to introduce our OsteoStitch in this manner. So in this way, the OsteoStitch device, the needle will not be entangling with the soft tissues around the portal. So once it enters, it can be used to reduce the meniscus, and then we just use it to pierce the meniscus in this manner. Once it is pierced, we try to deploy it. So once we do this, you can clearly see this. We deploy the first implant. Here you can see the deployment windows, two windows. So once the first implant is deployed, one of the two windows will become black. The other is still not black. So when we deploy the second implant, even this one turns into black. So we can visibly understand whether we have deployed the implant exactly at the location. Number two, we can also hear an audible click, which is confirmatory that implant is deployed. So the implant here is 1 into 5 mm, which is like 1 mm thick, which is very small. So once the implant is deployed, we can just move out the needle using a rotatory force, and once the needle is out, you can see that the implant is sitting very nicely on the posterior part of the meniscus. Now the second bite is again taken using similar kind of technique, pierced, and then just to show in the demonstration, we can use this button. When we use it like this, we can use this same button to deploy the second implant. So again bring it out through the portal, and once it is out, all we have to do is just pull this thread. The self knot which is already present will just sit on the meniscus. Once we pull this thread, the knot automatically goes and sits on the meniscus, reducing the meniscus and repairing it. Once it is done, it is closely cut by the knot cutter, and you can clearly see the implants that are deployed on the posterior part of the meniscus. So in this way, we are protecting the posterior structures and we are repairing the meniscus at the same time.